It certainly was not the epicenter of the pandemic a few weeks ago. Today, certainly it is. What happened there?
We opened too soon, clearly. The other thing that we did is we didn't hit this with a hammer at the beginning. 4 months ago, I said the worst thing that can happen to Florida is if we have to shut down again, if we don't really drive down COVID-19 down to small numbers. 14 days of going downward, we didn't do that. We opened before, and what's happening now is just tragic for the people of Florida, for the people of the country. But it shows that you have to take this disease seriously. Canada took it seriously. You listen to your public health officials. And unfortunately, this situation has been politicized, and it shouldn't be. This disease doesn't know what political party we belong to. And it's a terrible disease that requires enormous discipline by the public health officials, but more importantly, by the politicians. And we just didn't do what we needed to do at the beginning, and we opened too soon.
You're calling for some bold action today. Can you walk us through what exactly you want to happen in Florida?
I think that we have to close down again, but really close down with everyone wearing a mask. We've got to hit this with a hammer, and for 14 days, and drive COVID-19 down to numbers so that we can do contact tracing. And we can't do that by some half measures. We really have to hit it with everything we've got. And more importantly, we have to get more testing into the state. Everybody's running out of testing supplies. We have long lines for testing. We shouldn't be opening anything without a lot of testing. Look, your story about Disney. Disney has all the money in the world. It's like a bubble. They could do all of those things. No other place in the country has those kinds of resources. So we have to go back to the basics, to low tech, to closing down everything we can close down, to have everybody wear masks, to wash their hands and practice social distancing. That's the way we'll drive down this virus. If we don't, we're going to see more deaths, more infections, and more spinning out of control. And what happens in Florida doesn't stay in Florida.
Now, you have come out swinging against the Republican governor in Florida. You said that he denies science, which is leading to the spiraling problem in your state. What exactly is he denying, and what did you mean by that?
I mean that he did not take the public health people seriously. He uses the words, but he has not required everybody in the state to wear a mask. Our mayor has required everybody to wear a mask. The governor has not. That's the simplest thing a governor could do. And what I said about him is if he wanted these people, these politicians that run for office that don't want to make hard decisions. He opened too soon. He didn't require people to wear masks, and he hasn't to this date required people to wear masks or to practice social distancing or to wash their hands. And he's allowed certain places to open up, and that's been unfortunate. We just need clear leadership, and we don't get that out of Washington, and we haven't gotten it out of our governor. And the mayors are scurrying around trying to do their best.
Yesterday, President Trump wore a mask in public. That was the first time that he did so. And you said that it meant nothing to you. But this is certainly the sort of serious behavior that you've been calling for around this virus. What did you mean when you said that it meant nothing to you?
Because he qualified it. He said in certain circumstances, I have to wear a mask when I'm going into a hospital. That's not good enough. We need people to wear masks whenever there are other people around that aren't related to them and when they're outside. And the president has not been consistent. He's confused the American people with his behavior, and it's led to governors who follow him and particularly follow his demands to reopen the economy. And now he's demanding that we reopen the schools, and that's terrifying to many families in this country.
How can a state possibly beat this pandemic when its leaders remain so divided?
It's very difficult, and we should have had strong leadership from Washington from the beginning, from the president. We didn't have that. Other countries clearly have had that and have followed their public health officials' advice. Look, we have the greatest scientific institutions in the world. We have the CDC, the NIH, the FDA, the Public Health Service. Everybody has always looked to us. But what we have lacked this time is strong leadership from our president and from some of our governors. But you can't do it in states alone. The leadership has to come from the President of the United States and from his team.
Your country's top infectious disease expert, Dr. Anthony Fauci, hasn't briefed the president personally in 2 months. What do you think of this growing rift?
Well, it's unfortunate, and it's sort of inconsistent with what everyone tells us to do. But the one thing about Tony Fauci is that he has not closed his mouth. He is giving everybody good advice. And some people have taken it and some people haven't, but he is our top official. We ought to be listening to him. When I ran the Department of Health and Human Services, I worked with Tony Fauci for 8 years, and with all the other people that work, the civil servants that work. I never did anything except put them in front of me, often asking them to wear their white coats, because that's what the public trusts. And now we have totally confused the public on the science and on our leadership.
And on one lighter note before we go, I know that you're a supporter of Fauci's because I understand you just named your new dog Fauci.
Yes, here he is. I have a rescue dog that just arrived, and he ran into an Italian restaurant after being on the streets for a number of days. So they said, give him an Italian name, so I've named him Fauci. He's a COVID-19 dog.
Perfect. Well, that is a good gesture in the middle of a pandemic. And we also just want to thank you very much for spending some time with us today. Thank you.
You're welcome.